Crohn's disease, on the other hand, can affect anything from the mouth down to the very bottom, and so you can have any part of your GI tract affected by Crohn's disease.
If Crohn's disease is involving the mouth or the esophagus, the stomach, do they still have colon problems and small intestine problems, or it can be isolated?
It can be isolated in some cases, but that's a
Wow.
fairly rare presentation of Crohn's disease. Most patients with Crohn's disease are going to have involvement of the end of their small intestine and the right side of their colon. That probably comprises about 70% of Crohn's patients.
So what are their symptoms? Let's flip to Crohn's right here. What are their symptoms?
So Crohn's patients will typically come to you and complain of abdominal pain, diarrhea, sometimes some blood in the stool, and in many cases they'll have nutritional consequences, including weight loss.
So they have weight loss, nutritional consequences. They just get frail, they wither away. Why is that?
Well, in many cases with the inflammation where it's located in the small intestine, large intestine, they'll lose a lot of their macronutrients in the stool because they're not absorbing them as a result of that inflammation. Inflammation in general in the GI tract is also catabolic, so it'll participate in the breakdown of some of your proteins.
So it's not a fun disease to have. Is there treatment for it?
There's good treatment now available for both Crohn's disease and ulcerative colitis. You'll see ads on TV all the time for all these newfangled agents that help suppress the immune system so that the bowel can calm down and reestablish good health and then normal nutrition again as well.
So treatment of Crohn's disease, how does it differ from ulcerative colitis?
The aminosalicylate medications that we talked about earlier, which have traditionally been used for mild or moderate Crohn's, don't seem to work quite as well because they're delivered in the colon and they work topically. Many cases of Crohn's disease involve the end of the small intestine or upper parts of the small intestine, and so in many of those cases the disease is located farther up from where the drug is actually delivered. So a lot of the newer medicines that are available for Crohn's are systemic medications. They're medicines that are delivered by injection or by IV form so that they can circulate in the blood, come back to the GI tract, and work along the whole length of the gut.
What's the name of some of those medicines, and give me a little science on how those work?
So an example of some of these newer agents, they're called biologic agents basically. Remicade is an example that you'll see ads for TV on. Humira is another one. These are medicines that are synthesized in a lab. They are basically antibodies against a molecule that is seen in high quantities in the inflammation of these two diseases. So,
isn't it wonderful that we have those? So they're anti-tumor necrosis factor, if I remember the words, like that. And so you've got antibodies against those. Are they really effective? They really do a good job for patients?
They certainly do, and they've been studied very well also. There are lots and lots of patients now that have been studied and treated with these anti-tumor necrosis factor medications, and that goes beyond even the inflammatory bowel arena. Patients with rheumatoid arthritis and other autoimmune diseases have been treated with these medicines with success, and so we're thrilled that we have them because they work so well. There are instances sometimes where patients will take them, they might lose effect, they might have to switch to a different one, but on the whole they work very well.